Hey everyone, Dan Julian here, nurse practitioner for Dan Aesthetics Medical, and today we are honored to have Dr. Tom Van Eijk here join us for an Instagram Live. We're going to be covering his Ferning technique, his Palma technique, and other various techniques that he's developed. This is Dr. Tom Van Eijk. Dr. Tom Van Eijk is a cosmetic physician from Amsterdam. He's been practicing cosmetic injectables exclusively since 2003. He's actually a worldwide cosmetic physician, speaker, and trainer, and probably one of the most recognized physicians in the world right now when it comes to hyaluronic acid fillers. And it's a complete honor having you here. Thanks for joining us.
That's a nice intro. Yeah.
Let's get into it. Let's just kind of cover the differences in kind of techniques right off the bat. So if people aren't really aware of what the Ferning technique is, or Palma technique, or Ferning, so I drew a little picture. This is Sarah, by the way. She's like kind of YouTube famous right now. And basically what we're looking at is just the wrinkles here. And we have a few wrinkles here just along the side of the crows. And then we also have these accordion lines. But basically your idea is to place some product very superficially into the basic subdermal region, and you're placing it into the line, and you're making little strands, and it's creating intradermal for you.
That's the secret. We know that if you put hyaluronic acid subdermal, it will volumize. But you also see if you put it intradermal, you only need just a little bit to stiffen the skin. And the whole objective is to look at the face and to make an estimation of where do you want to recreate strength. And then when you put all the hyaluronic acid intradermal, especially like a fern leaf, you can see the midsection, because of the cross-hatching being so strong, this is the most effective way to strengthen the skin.
How long were you into your career whenever you started kind of creating this, and how did you figure this out? Were you just playing around? Does this come to your mind? How did the Ferning come to you?
If there's a weakness in the skin, why would you volumize? It doesn't make any sense. If it's something is weak, you need to strengthen. If it's hollow, you need to volumize. I had one specific patient. She was in the sunbed like twice a day, right? She had enormous sun damage. She had nasolabial folds, and she had lines crossing those nasolabial folds. And I did the Fern on her. And I saw her as she came back 2 weeks later. She was very unsatisfied because all the horizontal lines were still there, but the nasolabial folds were gone. So she was unhappy, and I was happy, because that showed that everything perpendicular to the line was effective in reducing that weakness. Everything parallel to the line just doesn't work.
It's amazing, and I do appreciate you sharing that story with us. I came to treating necklines, which were really difficult. I'm going to show you kind of basically a little quick drawing of how I do that. Let's say if this is the fat pad, I don't want to be in the fat pad. I just want to be just above it. I want to feel some resistance. So what I place is my first strand of, let's say if it's RJ1 or something very, very thin, deep here, and I'll place a little bit of a thicker strand, and then I'll go back in between the dermis and epidermis, where I actually can see the gray of the needle, and I can feel, and I can see little blebs of the filler pop up. And it's the only one I kind of feel comfortable doing that with right now, because it doesn't tingle. However, it doesn't last very long, and I'm getting great results. The necklines last forever. But anytime I'm doing anything around here, I typically get maybe 2 to 3 months. And then after that, if I do a top-up, I get a little bit longer. Have you tried anything similar? And what do you think of the product, rheology, and what you use?
Well, the thing is, if you want longevity, you need to be in the dermis. If you put hyaluronic acid, and especially a tough, grainy, high G' hyaluronic acid in the dermis, will stick and it gives strength. So if you're just realize there's a strengthener in your hand, all you need to do is look for a weakness. Then you got your longevity.
So right now, what I've been doing to get a little bit more longevity is every time I'm doing this, because I'm into the dermis, I am creating a little bit of collagen stimulation because I'm irritating those tissues. And as you mentioned, the fibroblasts and everything, it does tend to produce more collagen, so they will get a little bit more longevity. I do feel, though, if I do a second session, it just seems to stimulate a
Absolutely.
little bit more. I'm not
Absolutely.
sure about that.
Yes.
Yeah.
I tend to repeat the same treatment every 3 months until somebody is happy, like corrected in a sense that fits her face and her social circle or his social circle, and after that it's once a year.
Yeah, so right now what I'm doing is I'll do the bidermal plane technique or whatever technique that I'm going superficially to have some structure. And then after that, what I'm encouraging is either Sculptra or Hyper Radiesse to encourage more collagen production, stimulate more collagen production. And then with a follow-up with these techniques, it ends up looking really great. And at the same time, you need a lot less product. And I think that that's one of the big things about what you are offering, and what's nice about these intradermal techniques is that you don't need a lot of product. And a lot of people are worried. They'll say, well, I'm worried about, how long is this going to last? Don't you have to repeat this in, 3 or 6 months? Well, the amount of product that you need is so minute.
Yeah, to be honest, I think that's what people worry about. I mean, we get paid by the syringe. And of course, we all know that you can spend 5 minutes injecting 2 syringes easily. Or you can spend 30 minutes on one syringe and have a beautiful result. And I think that's the way that, like for instance, in the US, I have my biggest audience in terms of NPs and RNs, because competition is so high. They want the result. They don't care about selling one syringe more. They care about the result. And I was lucky enough to be in a clinic where it didn't really matter how much we sold. And it was just about doing our best and seeing how we can have this beautiful effect rather than running a business. If you take the business side out of it, and if you treat everybody like it's your sister or your mother, I think you get closer to your own ethical truth in what the ideal treatment would be.
How do you feel about trends? Let's have an honest conversation about what do you think about these things and potentially what can happen in the future.
Well, trends are difficult. I mean, trends are trends for the wrong reason, right? Like every journalist asks me, okay, what's new in the business? And what's new is not, it's exciting maybe, but it's not what I want. And I've been doing this game for 2 decades. I've seen them come and go, trends and whatnot, and the lip taping and silly stuff like that. And it's Instagram. I mean, you get likes, you get followers. At the end of the day, would you do it to your mother? Don't think so.
Thank you, my good man. Thank you for joining me. This is a great discussion. Thanks, everyone, for joining.
Oh, yeah.
Everyone, happy holidays.
Oh.
Take care of each other. Get some exercise in.
Okay. Bye-bye.
All the best. Take care. See ya.